Gary, I like to do this way as opposed to read your resume. If you were walking down the street and you pass a stranger and they were really interested in you, they're having a dynamic conversation. What would you tell them that you do for a living?
I specialize in treating people with chronic illness and chronic pain. So we see a lot of people who have chronic fatigue syndrome, ME/CSF. We see a lot of people with fibromyalgia. We see a lot of people who have uh, neuropsychiatric illness in terms of depressions and uh, obsessive compulsive disorder. People who have been kind of dismissed by the medical profession as, you're kind of crazy, but you're not getting better with any of the medications and the stuff we're doing. Then we also see a lot of pandas kids. And I think that in the work that I've done, so these are these acute onset um, pediatric neuroinflammatory diseases. Basically, what I specialize is in brain on fire, treating
Mhm.
people whose brains have become lit as a result of infections, which have tripped off the immune system. And now the immune system is attacking your own brain. And so this is something that affects not 15 people, but rather probably close to 20 million people. And I think that there's a huge number of people who have been seriously misdiagnosed because they've been told they've been diagnosed by their symptoms. So fatigue is a symptom; it's not a disease. Uh, Chronic pain is a symptom; it's not the disease. Depression is a symptom; it is not the disease. And so, what we need to do is step back, and now we understand a whole bunch more than we used to. But we need to step back and say, okay, these are the symptoms, and especially when you've got not one, not two, not three, not four symptoms. So you got sleep disturbances, you have problems with chronic daily headaches, you have problems with brain fog, focus and concentration, you have problems with chronic pain. You have, and the pain is moving around your body on top of it. So it's not just one place that hurts all the time. You have problems with digestive issues, and you have problems with you stand up and you fall down. That's called POTS, postural orthostatic tachycardic syndrome. And so you've got now what we're looking at is these multi-system problems going on where it's not a thing, but rather it's multiple things not working in your body. And then the question is, what's the unifying factor? As a rule, what the unifying factor is, your brain's on fire. That throws off your endocrine system. That throws off your whole immune system's been thrown off, which is what caused the brain to get on fire to begin with. So that's what I specialize in. I specialize in people whose brain are kind of on fire as a result of an infection that's done damage to the immune system and now tripped off with, I'm not supposed to say, but what is officially referred to as autoimmune encephalopathy of infectious etiology. So infections, breaking the immune system, causing a misstep where the immune system, as opposed to just attacking the bugs, is now attacking your brain.
Yeah. So if we met on the street and you said that to me, I'm not letting you go. Like we're gonna sit down. I'm like, we're gonna find a park bench. I'm gonna grab my either my recorder, my cell phone, or my notepad, and we're gonna start taking notes.